Welcome to the podcast on psychological first aid. And I'm here today with Pernille Hansen, who is an MHPSS specialist, and we will talk about psychological first aid. For the conversation here, we will say PFA whenever we mean psychological first aid. Pernille Hansen has just developed the IFRC online training module on PFA in COVID-19. So, Pernille Hansen, would you say a bit about yourself?
Thank you. Thank you very much for having me today, Ea. I'm a psychologist, and as you mentioned, I've worked with mental health and psychosocial support in emergencies and crisis situations for many years. In the past few years, I worked with the PS Centre to develop reference and training material on psychological first aid, and the most recent materials that you mentioned on PFA for the COVID-19 response.
So there's a wealth of materials that you have already developed. So let's start about a brief introduction. What is psychological first aid?
Great. A really simple way of explaining psychological first aid is that it's a set of skills and knowledge that can be used to help people in distress. It's also a method, a way of helping people to feel calm and to be able to cope with their challenges in a difficult situation. So the IFRC, the Psychosocial Reference Centre, we follow the PFA approach that's recommended by WHO, which is based on 3 simple action principles of look, listen, and link. And using these 3 action principles, the helper does a number of concrete and practical things to help someone who's in distress so that they can cope better with their challenges.
So you're almost answering my next question, which is, so when is it useful? You're saying somebody in distress, but somebody could be in distress because they've just witnessed an accident, but maybe somebody's in distress for other reasons. What could other reasons be? Or situations?
It can be from a very simple, small personal situation, like, for example, if you just received a phone call where you heard some stressful news, or it could be a bigger, more difficult event like being in a car accident. The key thing about psychological first aid is that it can help someone at any point during or after an event. It doesn't have to be immediately after, but it could be even weeks after an event has taken place, or months or years, if something reactivates a feeling of distress. So PFA skills can help in emergency and non-emergency situations, and in personal or public crisis. The key factor is really to consider whether a person is in distress and if the person needs and wants your help.
Oh, good. So in the context of the Red Cross, Red Crescent, who should be trained in psychological first aid?
Honestly, anyone who is interested in helping other people. So that actually includes all staff and volunteers working for Red Cross or Red Crescent national societies. PFA skills are useful not only in work situations, but also in one's personal life. You may use PFA skills when a friend or family member is in distress, or you could even use them to help yourself when you feel distress. I would say that also people who have the responsibility for caring for others, so for example, team leaders or managers who care for staff and volunteers, they could also benefit from learning PFA skills.
Interesting. And now let's turn our attention to the current pandemic situation. So what would you say is different if you have to provide PFA to somebody in the context of COVID-19?
It's really good that you bring that up, because of course this situation is new and unprecedented for all of us, mostly because we are not able to engage face to face in the way that we're used to, or interact socially the ways that we're used to. So you can still, of course, use PFA skills and provide psychological first aid, but we do need to adapt our methods of communication. So in this current situation of the pandemic, we're now relying on remote communication. So phone calls, messages, video calls, and this is new for a lot of people, which means that a lot of people have to learn and practice how to provide PFA in this remote manner.
And the challenges are that you can't be with one another, as you say, you can't read the body language that we really rely on a lot. And would you mention other challenges?
Well, I think it's a key thing that we do as PFA helpers is we rely a lot on our sight and what we observe. So obviously we're unable to do that if we can't see people. Which means that we have to use questions more and ask about things that we would usually observe. So I'd say, for example, if someone calls you and they're in distress, one of the first things to find out through questions is where the person is, are they physically safe, do they have any physical injuries? And these are things that normally you'd be able to see if you were with them. Another challenge could be how to calm someone who's in distress remotely. We usually rely on our physical interaction when we calm someone, for example, by looking them in the eye or using our body language to show that we're with them. So when you're unable to do that, then you have to rely more on your voice, on speaking calmly and clearly, and connecting with the other person more through words than through body language as we did before.
Oh, great. Yeah, good to think about. And is all this covered in the new PFA training that you have developed?
Absolutely. So the new online PFA training, it's both generally about PFA, but it also pays specific attention to remote PFA and to the specific challenges that are faced now in relation to the COVID-19 outbreak. In the training, you learn about the look, listen, link actions that I mentioned earlier, but specifically how to use those skills remotely.
Sounds very good and very useful. And also the new set of materials can be used in many versatile and different ways. Could you explain more about how it can be used?
So the new training materials are basically based on a simple PowerPoint presentation that a facilitator can use to conduct face-to-face trainings if possible, but more importantly, they can easily be used to conduct live online trainings or to create a recorded training that people can watch at any convenient time if they're not able to attend a live online training. The materials are also accompanied by a short guide that explains how you can adapt and use the training so that it's relevant to your specific context. The materials are written very simply and presented very simply, so they're easy to translate into different languages. The training also includes a simple worksheet that participants complete as they take part in the training. There are also some small short videos that demonstrate PFA skills. So the idea is that when different national societies download the trainings, they would use these as a template or a model, but quickly adapt and create their own. So for example, the little videos, it would be great if people made their own local videos in local languages so that the people who are watching relate to it and understand it very easily.
That sounds absolutely fantastic. So congratulations on that work. And let me the final question. Let me ask you, what are you working on next?
We are working on some additional mini modules for the PFA for COVID-19 training that staff and volunteers have expressed an interest in. So we'll be doing a little more in-depth training on self-care, on how to remotely care for staff and volunteers, on PFA for children, and we'll also do a short module on how to help people deal with grief and loss.
Fascinating. Can't wait. So thank you very much, Pernille Hansen, for taking the time to do this conversation with me and introducing the psychological first aid, what it is, how it can be used, and also the new training material. And I would like to end by quoting you. You said the material is for anyone who's interested in helping others and also helping themselves. I think this is a brilliant way to end the conversation. Would you have anything to add?
No, I think you've captured it really well, and thank you for giving me this opportunity.
Thank you very much.